give you a couple packs of needles. It comes with a guide tube and inside are needles, and everything is sterile. And you simply pick up the guide tube and then load the handle of the needle into the guide tube. So try that first. So you pick up the guide tube and now pick up a needle, right? And now put the handle, that's the tip, put the handle into it.
Like this?
You're holding the handle, right? So put the handle first, not the tip, the handle.
This?
No,
Oh.
put this handle into the tube. Nope, that's the tip. That's the tip of the needle. So put this
sorry.
into the tube first.
I'm so sorry.
Are you nervous?
No,
Okay.
I just don't know. Okay.
And put your thumb at the bottom so it doesn't fall out. Put your thumb or your finger at the bottom so it doesn't fall out. There. Great. Now the needle is loaded into the tube, and you can see there's a little sticking out. Okay. Now it's pointing up right now, so level it so it doesn't fall out. And then with your left hand, pull the needle out a little bit so the tip recesses into the tube. Great. Now the tip won't get contaminated, and you're ready to place the tube down onto the skin. So when you place, yeah, that's exactly what I was going to say. Figure out how to hold the needle and the tube at the same time. Exactly.
Yeah.
Now when you place the needle, you have to figure out where it's going to go, and that's what your other hand is for. It doesn't matter, left or right hand, right?
Okay.
So this muscle here is probably the single most important for knee pain, right? It's a thick muscle, which means that if you needle it here, the blood flow will increase like crazy, which is exactly what we want. If she has inflammation, it'll drain some of the swelling out. It'll also create all the good stuff, immune responses, it'll reduce some tension, all that. And you can see the muscle by asking her to dorsiflex. Can you bring your toes toward my finger, Akima? Yeah, good, like that. You see the muscle popping out? And then relax, Akima. Relax.
Chorama.
Yeah. So you can see the border of the muscle. Here's the top border. See that top border there? Yeah. So any place about 3 inches below this divot, 3 to 5 inches below the divot in the muscle is good. There's the bone here. So what I'd like you to do is just feel the bone and then feel the muscle. And put the needle where it
The muscle is this.
That's right. Exactly. Put the needle where it sort of makes sense to you in the muscle.
It shouldn't be in the green veins.
If you see a vein, avoid it.
Yes.
Yeah, it's better. Yeah, like I said, with this kind of acupuncture, it's the area that you needle that's important, right? So if the muscle is like this wide, and if it's like this long,
Can put it here?
yeah, or you could put it even above the muscle, but that will be fine. Put it there, but I would go into the muscle because as much as possible, because that's going to have a little bit greater effect.
Here, right?
Yeah. So now place the tube down onto the skin. Yeah, and then with your other hand, feel for where the bone is. Use the bony landmark. And feel for where the edge of the muscle is back here. Yeah, and now put it in the middle so you're away from the bone and well into the belly of the muscle. So just pick it up and move it back this way, like right about here. That's good. Great. Are you right or left-handed?
Right.
Okay. So then hold the tube with your left hand down at the bottom. So let your fingers come down here. And then with your right index finger, I'm gonna tap your left hand, okay? I want you to give a firm tap twice, like that.
Here, like this?
Like that.
Okay.
Okay?
Like this? Okay.
Good. How was that, Akima? Yeah, good, great. Now remove the tube. Okay, fantastic. And you can put the tube down. Good job.
Thank you.
Yeah. Now, if it ever stings, if there's ever, excuse me, like superficial pain in the skin, you just take it out and rub, and that will relieve the pain.
Rub where?
Rub right where it hurts.
Okay.
Or just leave it alone, and then reinsert a little bit down, a little bit up, a little bit to the side, right? Like I said, it's the area that's important.
But do you think it should go more?
More inside? Yeah, that's the second step. So we just inserted it subcutaneous, right below the skin.
Yeah.
So now we're going to insert it down into the muscle. Now you can see the muscle is right below the skin, right? Because you can see the contour of the muscle on her. She has good muscle tone there. So you simply insert the needle into the muscle, which in this case looks perpendicular to the surface. You insert it down, probably about quarter of an inch, half an inch. Do you know how big that is? I think
This
that's.
much? I don't know. I'm just guessing.
Yeah, it's about half the size of your pinky nail, right? Or full size, yeah. So that's what, 3 centimeters?
Okay. Here.
Yeah, like that will be perfect. Yeah, just like that. Yeah. So simply hold the needle with your right hand and stabilize the muscle with your left hand, because you can use the left hand to manipulate the angle and to manipulate the muscle. This is very simple. And you simply hold it and push the needle down into the muscle. And that's it. Yeah.
Did I do a lot? Yeah, I think.
You did a lot for you, for your first acupuncture experience.
No,
yeah.
I'm saying, did I went inside
Oh, did you go too far?
too far? or no?
Maybe a little bit, yeah. Yeah, why don't you pull it out, split the difference, right? So not all the way out, not where it is, but halfway. And yeah, keep going. Yeah, and after a while you'll feel where to stop, because the muscle will feel like a little bit, like it's pulling on the needle. It feels a little heavy when it's in the muscle, right? Great.
ठीक है माँ?
Yeah, so that's that one.
पानी चाहिए होगा तो बताना.
So now pick up the tube and load one more needle. And again, just remember to block the other end of the tube so it doesn't fall out. Great. Now the second point that we're going to be needling is right in front of this bone here. So if you feel this bone, there's like a nodule there, which is the top of the fibula, right? You feel that? Great. So if you go kind of diagonal from there towards the tibia, you'll come off of this group of muscles, and before you hit the tibialis anterior, the shin muscle, there's like a space between them, right? Yeah.
Here.
Yep, that's right. Exactly right. Now, again, it's about location, right? There'll be benefit whether you needle between those, which is the location of the point, or a little lower, which is the location of another point, or in the peroneal muscles, or even in the tibialis anterior fibers. Anywhere in this area, there you'll get some benefit. This one, the feeling of the dull, achy sensation that she's going to have, and the feeling of the heaviness at the tip of the needle that you'll feel is much less than here, because we're not needling into a muscle, we're needling between them. Yeah? So take your time, and when you're ready, place the needle
It could
on.
be anywhere. Here. Can I
Yeah,
do it here?
yeah. It's the area that's beneficial, in my opinion, is like this big.
Okay.
But I always feel for the head of the fibula, and then I go diagonal until I go over I feel my finger going over the muscle fibers and down into like a valley.
So where do you want me to do? Where do you think?
I want you to find it. Actually, you found it perfectly the first time.
Here.
That would be fine, yeah. That'd be fine. Good. And for this, you're going to have to turn your hand, your right hand. That's fine, yeah. And you can do kind of the mean way. I wouldn't. You gotta be. I would prefer that you be significantly firm and fast with the tap, right? So you can use your fingernail,
Okay.
or you can turn your hand and go like this, right? Which is a little awkward, but you can do it. If you want to stand where I'm standing, that would be fine too. Anything. It's really not complicated. Yeah. Good. That's it.
Done?
Yeah.
Or should I do one more time?
You can do one more. She's not in pain. Good. That's it. Just remove the tube. Set the tube down. Yep.
Okay.
Yep.
Should I?
Yeah. So now, can I see the tube for a second? So now, instead of holding it at this angle, it'd be a little easier for you if you hold it at this angle, right? To press it in. Yep. Yeah. Good. Yep.
अम्मा ठीक है?
And you can twist it if there's a little resistance. You can twist it and it'll go in a little more easily. Yeah, that's good. That's good. Great.
Oh,
Yeah.
there is a
Try
little
not to.
resistance.
It's okay. Try not to bend it, but this is fine. Let me feel. Yeah, yeah, and that feels good, and this definitely feels good. I literally could not have done it better myself. Seriously. Okay, now last one. Tube and needle. And then we're going to needle this point right above the patella, so you can see the kneecap very clearly. You just go above the kneecap, and the point is off the bone. So if you use your fingertip, you can feel the bone here, right? You feel the border of the bone, and you just go anywhere above that, right? You can needle a good, I would say, 7 or 8 centimeters wide in that area. Yeah, and you angle it down underneath the patella. Yeah. Let your palpation be a little easier, right? Don't press quite so hard, right? Especially when needles are already in.
Okay.
You can feel a lot with light pressure.
Yeah.
Yep. Great.
Can do it here.
I would go for the center. Draw a line from the center of the kneecap up
Here.
above. That's pretty far up. Can you get closer to the kneecap? Feel where the border is, and I would put the needle. I would put it right there. That's okay. So that
I'm
needle.
sorry,
No,
I
no, no.
forgot.
Don't
Yeah.
reuse it.
Oh,
Don't reuse
sorry.
it. Right.
Okay.
So that needle's contaminated. You're gonna stick it like a pincushion in there, right? It wasn't in anyone's body, so that just tells us not to use it. So grab a clean needle. Other way. Load the handle. Okay.
I
Next time.
think I'm.
No, it's okay. You
Fine?
didn't. Yeah. The tube is being used on her.
Okay.
Right. So it's got her microbes on it. It's okay.
Okay.
It's all right. But if you load the tip, sometimes you'll
Yeah.
dull the tip a little, and it just makes it more difficult
Yeah.
to insert it. But that's all right. Yeah.
Okay.
So you hold it like a cigarette. Why is that?
I don't know.
You have something to confess to while your mother is here?
No.
Go ahead and put the guide tube down.
I don't even smoke. Okay.
Good for you. Yeah.
So should I do it here?
Either one of the 2 spots you're touching would be fine. Yeah. That's good. And back the needle out so that
Oh,
it's
yeah.
not sticking out of the. Yeah, good like that. See how you just intuitively switch your hand, your grip? Yeah. And angle it like this, because this one's not perpendicular at this point. You want to get the tip of the needle to go towards the patella, even under the patella a little bit if you can. Why don't we just for today, I'm going to replace it down about there.
Okay.
All right? You can see the border of the patella-ish, right?
Yeah.
Yeah. So again, firm tap. Good. Great. So you're done needling for today, so ditch the tube. That's great. Okay. Now, the angle of the needle is a little bit, what's the word? It's a little bit up. It needs to be angled just a little bit more acute, right?
Okay.
Right. So it's very shallow in the skin. It's not going to hurt or bend the needle at all in the body if you angle it down a little bit. Right, look at the angle of that one.
Yeah.
Right, it's like 45 degrees. So after I messed with it, this is fine. Yeah, and now simply hold the needle firmly and push. And if you feel too much resistance, you can twist the needle. Yep, good. It looks like it's going into the space between the patella and the femur. This is good. And it's fantastic. Yeah, just like that. Great.
दर्द हो रही है अम्मा? तो बताएं ना.
What?
Okay. Yeah, no, I was asking if it's hurting, you should tell.
Yeah. All right, so that whole thing took you less than 15 minutes for your first time, not knowing where anything was, not knowing how to handle the equipment, and not knowing really how to keep it from getting contaminated. And less than 15 minutes, you did a full acupuncture treatment for knee pain. Yeah. So now, after about 3 weeks, if you do this once a week for 3 weeks, you're going to get it down to like 10 minutes easily. And the more you touch,